Every week, people come to my office who have been suffering from neck pain for 3, 5, or even 10 years. They bring folders full of MRI reports, boxes of pills in their bags, and they've tried every massage and physical therapy technique out there. And they're still not better, and when I sit down with them to take their history, I discover something that comes up again and again. It's not what they're doing that's holding them back, it's what they believe about their own neck. If you've been dealing with neck pain for a while, that neck pain, that pain in the trapezius area, this is going to stir something inside you because there are 5 very specific ideas about neck pain that, when someone believes them, make any treatment work worse for them. Even if the treatment is good, even if the physical therapist is good, even if the exercise is done perfectly, the false belief blocks the result, and of the 5 I'm going to debunk today, all of them are backed by an international clinical guideline. Published in 2025 by a network meta-analysis of 40 clinical trials and by a recent Cochrane review, which have reviewed practically all the evidence. Is this the scientific evidence we have today about neck pain? I mean, I'm talking to you about science, not my own beliefs. In this video, we'll examine the 5 myths individually. Believing them hinders your improvement, even if you try. Even if the treatment you receive is good, and at the end, I'm going to link the videos where I have the routines and specific exercises I prescribe for neck pain, so you can get started today. But before we start, I want to let you know that Shoulder Week is back, the best event to relieve your neck pain, which happens only once a year, this time from June 22nd to 28th. I will be live for 7 days offering you the best information, advice, and exercises to improve your health and quality of life. You can simply go to the link that appears right here, above me, in the description, or in the first comment of the video. We scroll down to here, enter your Gmail address, and you'll be signed up. You'll receive an email in your inbox. If you don't get it, check your spam and promotions folders. And at the end, you'll reach this webpage where you can also join the program's WhatsApp community. It's very useful because we already know that emails often end up in your spam or promotions folders and you wind up missing a class. Tap here from your phone, join, and that's it. Your number will never be shared and I'll be the only one who can post in that community. If you want more information, down here you have everything we'll cover each day. Find out if this event is for you. And a lot of people who have already done this neck week with Andrea before. I sincerely hope to see you live on June 22nd because I will be giving 100% to help you improve your neck pain. Also, before we get into the myths, let me tell you about an idea that runs throughout this video. What you believe about your own neck is part of the treatment. If you start treating yourself with fear, thinking that your neck is broken or that any movement can make it worse, your brain can keep pain going even if your body is healed. It's like a car with a good engine, but the handbrake on. The engine works, but you don't move forward. That's why we're going to break down these 5 myths one by one, so you can release the brake before you start moving. The first myth is very common, and I hear it almost every day in my practice. It could be summed up like this. My cervical MRI reveals exactly the cause of my pain. The person comes in with their MRI report. They read words like straightening, protrusion, disc degeneration, facet arthrosis, impingement, and they hold on to that label as if it were their new identity. I'm Carmen and I have a protrusion at C5, C6, I'm Manolo and I have cervical arthrosis. Well, look at what the data says. A 10-year longitudinal study following hundreds of people showed something that should be taught in every consultation. And that is that cervical disc degeneration progressed in 85% of patients, but only 34% developed symptoms, including pain. That is, more than half of the people who have a cervical spine that degenerates over the years that shows signs of aging, protrusion, arthrosis, disc herniation. They don't feel any pain at all, and on the other hand, there are people with perfectly healthy MRIs who have disabling pain. The correlation between what is seen in the image and what the person feels is simply very poor. That's why at the American College of Radiology, which is one of the best radiology colleges in the world, they don't recommend doing cervical MRIs as the first test. Unless there are red flags, and when I talk about red flags, I mean very specific signs like significant loss of strength in the hands or arms, difficulty walking, or balance problems, severe nighttime pain that doesn't go away with anything after a long time, fever, recent serious trauma, or unexplained weight loss. If you have any of those, yes, obviously we need to do a cervical MRI, but if your pain is just the typical everyday neck pain without any of that, your MRI, in most cases it shows normal findings from the passage of time, joint aging, just like gray hair or wrinkles. Okay? It doesn't have to be the cause of your pain. I hope this is very clear to you. The second myth is going to affect a lot of people, and it's the idea that surgery is the definitive solution for neck pain. The person has tried physical therapy, pills, and injections, and is eventually told that without surgery, their condition won't improve. And when you're tired of being in pain, surgery obviously sounds like a good way out, like a light at the end of the tunnel. Well, what the major reviews published in research journals show is actually quite uncomfortable. And at the same time, it's very revealing. Cervical surgery, especially when we're talking about decompression, discectomy for herniated disc problems, is more effective than conservative treatment in the short term. That's a fact. In the months following surgery, the results will always be better than if you did nothing. The operated patient improves faster in terms of pain and function than the patient who only continues with rehabilitation, but something interesting happens when we extend that follow-up. After 2 years, that difference has already decreased quite a bit. And after 5 or 10 years, the results between the operated group and the non-operated group become similar in most patients with non-specific neck pain. And why does this happen? Well, for a pretty simple reason, and that's that surgery solves a specific mechanical problem, a herniation that's compressing a narrowed area, a joint that's degenerated, but it doesn't address what's underneath. Usually it's weak deep cervical muscles, poor effort tolerance, and unaddressed postural and movement habits. That's why many people who have had surgery, after a few months of improvement, start to feel discomfort similar to what they had before, because the underlying issue, the root of all this, is still there. This doesn't mean that cervical surgery isn't useful. There are very specific cases where it's clearly indicated, and any physical therapist will tell you the same thing. When there is nerve compression with progressive loss of strength in the arm or hand, when there are clear signs of myelopathy, with problems walking or with balance, when there is radicular pain that does not respond to conservative treatment for several months, then surgery does change the prognosis, and you shouldn't hesitate to do it. If this is not your case, well-dosed exercise, education, good progression, improving sleep, stress, and nutrition is the most reasonable strategy to start treating your pain. The third myth will likely provoke you the most, as it's a favorite belief of half the internet. The idea that to cure your neck pain, the most important thing is to correct your posture, sit up straight, stick out your chest, look at the horizon, put down your phone, and sleep with the perfect pillow. Well, that's awkward because the relationship between forward head posture and neck pain is much more complicated than what we were sold many years ago. Science says that there is some relationship between posture and pain in older people, but in young people, no significant association was found. Even the use of the cell phone, which is always blamed for neck pain and back pain, isn't as responsible as we thought. There is a study that has shown that using a cell phone while studying can even improve neck pain. And this obviously really breaks the simplistic narrative of look at the horizon, sit up straight, and that's how you'll cure your neck pain. The perfect single posture doesn't exist. What does exist is holding any posture for hours, whatever it may be, and the lack of deep strength in the neck. Realize one thing, if you sit perfectly straight and hold that posture for 8 hours without moving, it's going to hurt just as much or even more than if you work a bit hunched over, but get up every 40 minutes to walk for 2 minutes. The problem isn't the exact shape of your posture, the problem is immobility. Forward head posture isn't the main cause of your pain. At most, it's a consequence of having weak, deep cervical muscles. And working on that strength matters much more for your recovery than chasing a certain posture. The ideal posture isn't even clearly defined in the literature. That's why, in my practice, I focus more on building good habits, moving more throughout the day, and adapting workstations to make them more dynamic. And of course, deep neck strengthening exercise routines, which I'll obviously share with you at the end of the video so you can do them too. And by combining those two things, the results are infinitely better than if we just keep ourselves straight all day. The fourth myth has to do with the type of exercise, the kind that's needed to heal neck pain. A lot of people come to the clinic convinced that they need a very specific type of strengthening, super specific for their condition and C5, C6 disc herniation, with exercises that almost no one is able to prescribe. The reality is that there isn't a type of exercise that's clearly superior to the rest for chronic neck pain. And this was discovered by a meta-analysis of 40 clinical trials published in one of the top journals. In medicine, this frees us from thinking that a single movement or a single exercise is the most effective. Motor control, traditional muscle strengthening, yoga and Pilates, even Tai Chi all worked similarly in reducing pain. In fact, some practices that connect mind and body more, like Tai Chi and yoga, were slightly superior to the rest, probably because they incorporated breathing, stress regulation, and overall well-being improvement. The takeaway is really useful. The best neck exercise isn't the most complex, it's the one you'll do consistently for months. Consistency always beats specificity. There's no point in having the best exercise in the world if you never put it into practice. And this helps me reassure patients during consultations because it takes away the pressure of having to find the magic exercise, the perfect routine. The secret trick everyone thinks is unique doesn't exist. That magic exercise simply isn't real. Anyone who says otherwise is just selling empty promises. What really exists is the combination of movement, strength, patience, consistency, and that's all you really need to make it happen. And the fifth myth is probably the most dangerous one. It's the belief that pills are the most effective way to relieve neck pain. This idea is what gets people into a cycle of medications, from acetaminophen to anti-inflammatories, from anti-inflammatories to muscle relaxants, from muscle relaxants to opioids, until the body stops responding but the pain remains. Well, pay attention to this because it's incredible. The German Clinical Guide published in 2025 about neck pain. It found that exercise, changing habits, managing stress, and improving sleep quality was far superior to most drugs and invasive procedures such as injections, procedures that are the standard today. To treat pain, patient education, explaining where the pain comes from, explaining things like the ones I'm telling you about. Here in this video, it also showed a moderate effect and was even more effective than most medications. So we're back to the same point. Exercise, progressive movement, well dosed and adapted to you, surpasses any kind of passive treatment. And this is backed by the most recent science. And it's true that pills can be useful, but at a specific moment with a limited role, just to reduce a peak of acute pain that keeps you from moving or sleeping well. I understand that obviously, and I'm not against it. But the problem starts when the pill stops being a one-time tool and becomes the main strategy. When you've been taking anti-inflammatories or muscle relaxants every day for months. Not only are you not solving the problem, you're actually adding others, like effects on your digestive system, your sleep, or even, if you use opioids, issues with dependence. Movement doesn't have those side effects. And yes, it's true that it's much harder to do than just taking a pill, but it's worth investing that time in your health, in working on those tools that will help you get out of this pain situation. We've finished with these 5 myths. Let's briefly recap what they are so you can take them home in an organized way. 1. Your cervical MRI does not reveal the cause of your pain in most cases. 2. Cervical surgery is not the definitive solution for most neck pain. 3. Chasing the perfect posture is not that important, as we've been told over the years. 4. There is no magical exercise or one that's better than the rest. The best one is the one you will do consistently and that makes you feel good. And 5. Properly dosed exercise and patient education are more effective than pills, according to the most recent studies. Before we finish, let me tell you one last thing. Since I've debunked these 5 myths, I don't want to leave you without a concrete action. If you want to start moving smart from today, I invite you to sign up to the Neck Week. It's 7 days where I'll be live, expanding on all the topics we've covered today, working on the 3 most important pillars of exercise, with multiple variations: strength, mobility, and stability. So you can find the one that best suits your abilities, build confidence through consistency, and achieve a neck that's absolutely strong. To sign up, as I mentioned at the beginning, you just have to click on the link down below. First comment, video description. You go to the link, leave your email, and you'll be signed up. Forget the idea that to improve your neck pain, you have to rely on others. Take control of your own health. Learn the necessary skills to manage your pain and relieve it. Over the next few days, I will cover important pillars you need to manage your pain and relieve it through exercise. I hope this video helps open your eyes a bit, that you receive it according to your possibilities, and that you manage to have a healthier neck. Sign up if you need it, or if you know someone who does. I hope to see you live on June 22nd for the first day of the Neck Week. We have covered multiple pillars, different variations, and stability.